Alright, good morning. I'm going to do a nasotracheal suctioning. So the first thing I'm going to do is check the patient's chart. So once I'm done with that, then I'll knock on the patient's door and then I'll always introduce myself. And then I will wash my hands. So I wash my hands, dry them, and then I will apply on the appropriate gloving. And for nasotracheal suctioning, I can put on a gown, face shield, anything just in case if I have any splashing of any secretions that may have come out or anything like that. So beforehand, I'm always going to get the patient's vital signs. Once I am done with that, then I'll get everything ready. So here I have a nasotracheal suctioning kit. And so we have lubricating jelly. So I'm going to put that on either the lid of the basin thing or on a clean gauze. And then I would always get my gloves ready, sterile gloves ready. Then I would pour in my sterile water into the nasal catheter here, that way it sterilizes it. And then I'm going to measure up a patient's with a nasopharyngeal trumpet here. So I'm going to go with the earlobe just to double check, make sure it's the right size. Then you can also look at the opening to make sure it is the proper way. Proper sizing, not too big. And so you always want the bevel to go to the septum of the nasal airway. So you want it to go facing towards the middle. And then you can lubricate it before you place it in. And then the next thing you would want to do is hyperoxygenate the patient. So I'm going to put them on this rebreather mask. And then I'm just going to make sure this bag inflates before I place it onto the patient. Once the bag is inflated, then I can place it onto the patient to hyperoxygenate the lungs. It's just that makes it that way so it's easier to suction out anything, and it opens them up and loosens up a lot of the secretions for us. So once I am ready, I got that going, I will check the machine here. I'll set up my suctioning machine here. Now I'll get the tubing ready. So I have a long tube that will connect to the patient here, and it has a label. And then I have a vacuum, then I'll attach the smaller tubing to the vacuum. And I'll turn it on to regulate. It needs to be a negative 120 to 150. You can include it to see what it's going to go to. Once I'm ready, I can set this here so it doesn't lose its sterileness here. Doesn't touch the floor, doesn't touch the bedding. And when I'm ready, then I can place on my sterile gloves. And if they're too small, you can take off your other gloves if you can't get it on without issues. For these, you try not to touch anything with them, not to touch the ending part, just sit inside of them. Place it over, and whatever your dominant hand is, you can use that as your sterile hand. So I'm going to use my right hand as my sterile hand, and my left as my one to touch anything like the tubing, the take off the mask or anything like that. So then I take this hand, I grab the catheter, I'd place it into here, and the way you can tell it's connected is you start hearing a hissing sound. And then I'm going to take the end piece of the catheter and I'm going to suction up some sterile water to make sure it's properly suctioning. And then I'm going to take and put lubricate on the end of it, just that way it goes down nicely and it's not going to harm the patient. So when I am ready, I will remove this, remove the mask, and then I will begin to go in. So if you feel a resistance once you get down to towards where you need to be, you can pull it up just a little bit. That way you can get the appropriate suctioning. And you don't want to do it more than 15 seconds. So when you're ready, you can slowly creep it out like that. And if the doctor needs a sample, there can be a connection in between the nasal catheter and the tubing to get that sample of those secretions that may be down in the lungs. Then always you'll hyperoxygenate the lungs after you've done a suctioning. That way their lungs go back to normal. And then if you want to do another one, you'll need to re-sterilize it. Put in the section into the sterile water. And you can do it again. I want to do it more than 3 times. If you are finished with this, then you can wrap it around your glove like this. Carefully pull it off. Set this over here like that. And then you would remove it with your glove. Like that. And you dispose of those. And then when I'm done, I would go wash my hands, reapply some gloving, and then I would reassess the patient, check the patient's lung sounds, see if they sound better. I'd remove any of the PPE that I worn before I leave the room. Like if I wore a gown or a face shield, anything like that, I need to remove that before I leave the patient's room. And if the patient is good on their oxygen, their O2 levels are good, then I can remove their mask, and if they were on oxygen, I can place them on the oxygen that they were at. I shut this off, remove this, set it in the appropriate area, and then I'd also make sure this machine is shut off, off there. And once the patient is okay, then I can go and chart in the patient's charts, and then let the doctor and the nurses know that I did a nasotracheal sectioning.